Emollient Combination No.75 Lotion is used as a moisturizer to treat or prevent dry, rough, scaly, itchy skin and minor skin irritations, such as diaper rash and skin burns from radiation therapy. It contains substances that soften and moisturize the skin, decrease itching and flaking, and protect the skin against irritation. Dry skin is caused by a loss of water in the upper layer of the skin. Emollients/moisturizers work by forming an oily layer on the top of the skin that traps water in the skin. This lotion also contains ingredients that soften the top layer of skin cells, helping them to fall off and leaving the skin feeling smoother and softer. It is best to apply this lotion to the affected areas as needed. Make sure to use the Emollient Combination No.75 Lotion as directed on the product package. Some products may need to be shaken before use, so be sure to check the label for instructions. Apply the lotion to the affected areas of the skin as needed or as directed by your doctor. The frequency of application will depend on your skin condition. If using it for dry hands, you may need to apply it every time you wash your hands throughout the day. For diaper rash, make sure to clean the area well before applying the lotion. If using it for radiation skin burns, check with radiation personnel to see if it can be applied before therapy. Be sure to apply the lotion only to the skin and avoid sensitive areas like your eyes, mouth, nose, and vaginal/groin area unless directed otherwise. Always follow the directions on the label. Apply the lotion after bathing or showering while the skin is still damp to get the most benefit. If your skin is very dry, your doctor may recommend soaking the area before applying the lotion. If your condition persists or worsens, or if you think you may have a serious medical problem, seek medical help right away. When using Emollient Combination No.75 Lotion, it is important to be aware of potential side effects. While most people can use this lotion without any issues, some may experience burning, stinging, redness, or irritation. If these side effects persist or worsen, it is important to seek advice from your doctor or pharmacist. If your doctor has prescribed this medication, they have determined that the benefits outweigh the potential risks. Many people using this lotion do not experience any serious side effects. However, it is important to notify your doctor if you notice any unusual changes in your skin or signs of infection. While a serious allergic reaction to this lotion is rare, it is important to seek medical help immediately if you experience symptoms such as rash, itching, swelling, severe dizziness, or trouble breathing. It is also important to keep in mind that this is not a complete list of possible side effects. If you notice any other effects not mentioned here, it is important to consult with your doctor or pharmacist. In the U.S., you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before using this product, make sure to inform your doctor or pharmacist about any allergies you may have. This lotion may contain inactive ingredients that could cause allergic reactions. If you have any skin cuts, infections, or sores, be sure to consult your doctor or pharmacist before using this product. Some ingredients in the lotion, such as preservatives and fragrance, may make your skin more sensitive to the sun. Be sure to check the label for any warnings and ask your doctor or pharmacist if you need to take any special precautions when in the sun. If your skin is prone to acne breakouts, look for the word non-comedogenic on the label, which means it will not clog pores. Also, some products may stain or discolor clothing, so ask your doctor or pharmacist for more details. Before undergoing surgery, inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant or breastfeeding, consult your doctor before using this product. It's important to be aware that using Emollient Combination No.75 Lotion may interact with other medications you are taking, which could affect how well your medications work or increase your risk for serious side effects. It's essential to keep a list of all the products you use and share it with your doctor and pharmacist, including prescription/non-prescription drugs and herbal products. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. This will help ensure the safe and effective use of Emollient Combination No.75 Lotion. If this medication is swallowed, it can be harmful. If someone has taken too much and experiences severe symptoms such as fainting or difficulty breathing, call 911 immediately. Otherwise, contact a poison control center right away. In the U.S., residents can reach their local poison control center at 1-800-222-1222, while Canadian residents can call a provincial poison control center. To prevent dry skin, it's important to use lukewarm water for bathing, take baths or showers less frequently, and keep them short. Using a humidifier can also help when the air is dry. Emollient Combination No. 75 Lotion is one of the many types of emollient products available. It comes in the form of a lotion and is designed to help moisturize and soothe dry skin. It is important to consult with your doctor or pharmacist to determine if this product is the best option for you. The recommended usage is to apply the lotion to the affected areas of the skin as directed by your healthcare professional. It is best to use the lotion at regular intervals throughout the day for optimal moisturizing effects. If you forget to use Emollient Combination No. 75 Lotion as scheduled, you can apply it as soon as you remember. But remember not to use extra lotion or apply it more frequently than directed. Make sure to check the storage information on the package and ask your pharmacist if you have any questions. Keep all medications out of reach of children and pets. Avoid storing the foam canister near high heat or open flame, as it is under pressure. Do not puncture or burn the canister. Do not dispose of medications in the toilet or drain unless instructed. Properly discard this product and it is expired or no longer needed. Consult your pharmacist or local waste disposal company for more information. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.